Deadly flesh-eating bacteria in Florida waters, Vibrio cases decline, but danger persists. In Florida's waters, a lurking menace, deadly flesh-eating bacteria persist despite declining cases. By Doug Myers, digital content producer, CBS Texas. Ted Scouten, reporter. Updated on July 16, 2025 /7:21 p.m. Eastern Daylight Time /CBS Texas. A terrifying threat in Florida's waters. This year, 4 Floridians have succumbed to the deadly effects of Vibrio vulnificus, a flesh-eating bacterium lurking in warm, brackish waters across the state. Among the fatalities, 1 was reported in South Florida. With 11 confirmed cases so far in 2025, the numbers are significantly lower than the peak of 82 cases and 19 deaths in 2024, which health officials attributed to Hurricane Helene. Statewide impact. Since 2016, Florida has documented 448 cases and 100 deaths associated with this lethal bacteria. This year's fatalities occurred in Bay, Broward, Hillsborough, and St. Johns counties. Additional cases have been confirmed in Duval, Escambia, Lee, Manatee, Santa Rosa, and Walton counties, along with a second case in St. Johns. CDC, rare, yet devastating. Though rare, Vibrio vulnificus infections pose a serious threat, with the CDC estimating around 80,000 cases and 100 deaths annually in the U.S. Individuals with compromised immune systems or chronic health issues are particularly vulnerable to this bacterium. Severe symptoms and high-risk groups. According to Dr. Edward Hirsch, an infectious disease specialist at HCA Florida University Hospital, those at greatest risk include people with weakened immune systems, those undergoing chemotherapy, and those with liver disease. Symptoms of infection can manifest as blisters, swelling, nausea, vomiting, diarrhea, fever, and chills, potentially leading to tissue damage and severe complications. Prevention, key tips for safety. To minimize the risk of infection, Dr. Hirsch advises rinsing off after swimming in ocean water and ensuring seafood is thoroughly cooked. While the situation is alarming, he reassures us that such infections remain rare occurrences. Florida Health Department's response. CBS News Miami sought clarification from the Florida Department of Health in Broward County regarding the mode of transmission, whether through food or water, but received no response. Key facts about Vibrio vulnificus. Here are some essential facts about Vibrio vulnificus, as provided by the CDC. Infection pathways. Eating raw or undercooked shellfish, particularly oysters, or exposing open wounds to warm salt or brackish water can lead to infection. There is no evidence of person-to-person transmission. Diagnosis. Stool, wound, or blood cultures can diagnose the infection. Laboratories must be informed in advance to use the correct growth medium, and physicians should consider Vibrio in patients presenting with gastrointestinal symptoms or wound infections following seafood consumption or seawater exposure. Symptoms. Infections can result in watery diarrhea, vomiting, and abdominal pain. Skin infections from wounds exposed to seawater can lead to skin breakdown, ulcers, and, in severe cases, amputation. Bloodstream infections can be potentially fatal, causing symptoms such as fever, chills, low blood pressure, and blistering skin lesions. People with weakened immune systems or chronic liver disease are at a much higher risk. Preventive measures. To reduce your risk, avoid raw oysters and shellfish, always cook seafood thoroughly, prevent cross-contamination between raw and cooked seafood, keep open wounds away from warm salt or brackish water, wear gloves when handling raw shellfish or seafood, and refrigerate leftovers promptly and safely. Treatment. Immediate antibiotic treatment is crucial, and wound care is essential. In severe cases, amputation may be necessary. For further details, visit the CDC's Vibrio page. *Health. *South Florida. Doug Myers. Doug Myers is a digital content producer for CBS Texas. With extensive experience in journalism, he has worked for 4 newspapers in Texas and Louisiana and 3 television stations in Texas. Additionally, he has served as a digital content manager for a national trade association and as a communications director for a state agency. Flesh-eating bacteria in Florida, what you need to know. Bold warning, a deadly threat lurks in Florida's coastal waters, as 4 fatalities have now been linked to a flesh-eating bacterium. This concerning development, reported by the state's health department, highlights the persistent danger presented by Vibrio vulnificus, a bacterium that flourishes in warm, brackish seawater. Its numbers notably spike from May through October when water temperatures rise, creating ideal conditions for its proliferation. In what many view as a chilling reminder of nature's unpredictability, infections have been identified in 11 Florida counties this year. The tragic deaths occurred in Bay, Broward, Hillsborough, and St. Johns counties, with isolated cases also found in Duval, Escambia, Lee, Manatee, Santa Rosa, and Walton counties. St. Johns County even recorded 2 cases. Since 2016, a total of 89 deaths in Florida have been attributed to this bacterium. Interestingly, during the same period in 2024, the impacts of Hurricane Helene led to 19 deaths, underlining how environmental factors can drastically affect public health outcomes. But here's where it gets controversial. While most infections occur from consuming raw or undercooked shellfish, especially oysters, it is also possible to become infected when an open wound comes into contact with coastal waters. The Centers for Disease Control and Prevention estimates that about 80,000 cases of vibriosis occur annually in the United States, with around 52,000 of those linked to eating contaminated seafood. Common symptoms include fever, chills, redness, swelling, and nausea, which are signals that should not be ignored. This situation has spurred warnings from the Florida Department of Health, advising individuals with fresh cuts or scrapes to avoid entering the water. Equally important is the guidance for those with compromised immune systems to wear appropriate foot protection to help avoid cuts and injuries caused by the natural hazards of rocks and shells on the beach. And this is the part most people miss. Despite these advisories, many continue to engage in high-risk behaviors, prompting debates about personal responsibility versus public health safeguards. What measures should be prioritized to protect vulnerable populations? Are current advisories enough, or should we be re-evaluating how we manage natural water bodies in light of increasing bacterial threats? We invite you to consider these questions and share your insights. Do you agree with the current preventive measures, or do you believe a more radical approach is necessary? Your thoughts and opinions are encouraged in the comments below.